Hey everyone, and welcome back. Today, we're diving into some really fascinating research that explores the surprising role a super common mineral, zinc, might play in the incredibly complex world of cancer. It's a pretty wild question, right? We usually think of cancer treatments as these high-tech, futuristic therapies. But what if a key factor was something as basic as the mineral balance inside our own bodies? Well, that's exactly what we're going to dig into. Okay, before we go any further, just a quick but super important heads up. This is all for your information. It's meant to help you have smarter conversations with your oncologist. It is absolutely not, under any circumstances, medical advice. All right, let's get into it. We're going to start by looking at zinc in a whole new light. So forget just thinking about it for fighting off a cold. We're talking about its potential role as a huge and kind of unexpected player in cancer research. You know, most of us know zinc is good for us. It's a cornerstone of a healthy immune system, no doubt. But the latest research is painting a much more detailed picture, suggesting that zinc levels could be directly tied to how cancer develops and even how well our treatments work. So, what is this core connection that researchers keep seeing? Well, it turns out the link between zinc and cancer is surprisingly widespread. Think about zinc's main jobs in the body. It's like a master regulator for healthy cell growth. It powers our immune function, and it keeps inflammation in check. Each one of those is a critical battleground when the body is fighting cancer. And this really shows you the scale we're talking about. Researchers have found this consistent pattern of zinc deficiency in tissue samples across a whole bunch of different cancers, from prostate and breast all the way to liver and lung. This wasn't just a niche finding, it was a broad clinical pattern that made scientists sit up and take a much closer look. Okay, so now let's zoom in and see how this actually plays out in specific cancers. We're going to move from that broad connection to some hard data, and this is where things get really compelling. We'll kick things off with prostate cancer, mainly because a ton of the research has been focused right here, and it's given us some of the clearest initial clues about this relationship. And here's where it gets interesting. It's all about balance. A huge study found that it wasn't about megadoses. In fact, it was a very specific low-dose range, between just 1 and 24 milligrams a day, that was linked to the best outcomes. This idea of just enough is a really critical piece of the puzzle. And the impact? It's pretty significant. In a study with almost 5,800 men, those taking that low-dose zinc supplement had what scientists call a hazard ratio of 0.55. Now, in simple terms, that means their risk of lethal prostate cancer was nearly cut in half compared to guys not taking supplements. That's a staggering difference. Okay, let's switch gears and talk about breast cancer. Here, the research adds another fascinating layer to the story. It turns out it's not just about having enough zinc, but about its delicate balance with another mineral, copper. And this data right here is just striking. A study looking at 10-year survival rates found that women with the highest ratio of copper to zinc had about a 58% chance of survival. But for those with the lowest, most balanced ratio, that number shot up to over 82%. That strongly suggests the interplay, that dance between these two minerals, is incredibly important. All right, now for what might be the most exciting part of this whole story. How could this mineral balance actually affect some of the most advanced, cutting-edge cancer therapies we have today? So first, a real quick primer. Immunotherapy is a game-changing treatment that essentially takes the brakes off your body's own immune system, letting it recognize and go after cancer cells more effectively. It's an unbelievably powerful tool. And here's where it gets really interesting. Brand new evidence is suggesting that a patient's zinc levels could be a critical predictor of whether or not these advanced immunotherapy drugs are actually going to work for them. And the results from this study are just incredibly clear. For lung and colorectal cancer patients on immunotherapy, those with lower zinc levels had a median survival of about 10 months. But for the group with higher zinc levels, that number doubled to 20 months. A 2-fold increase in survival time. I mean, that's just remarkable. And you can tell the researchers themselves are really excited. This quote right here highlights the potential not just to predict who will respond best, but to actually come up with strategies, maybe even using zinc, to make these powerful treatments work even better for even more people. So let's pull all these different threads together. What's the single most important message from all of this research? Well, it really all comes down to one simple word: balance.
This table really sums it up nicely. First off, dosage is absolutely critical. We saw that low doses seem to be beneficial, while high doses, say over 75 milligrams, can actually become a risk. Second, that copper to zinc ratio is a really key indicator. And finally, zinc doesn't work alone. Its teamwork with other minerals like selenium is also directly linked to survival outcomes. So, what's the big takeaway here? It's not to rush out and buy a bottle of zinc supplements. The whole goal is to arm you with this information so you can have an informed, intelligent conversation with your doctor. So you can ask questions like, hey, could we check my mineral levels? Or, given this new research, what do you think about my situation? That is the real power of knowing this stuff.
And that really leaves us with a final big thought, doesn't it? As we learn more and more about the intricate chemistry happening inside all of us, how might this deeper understanding of something as simple as mineral balance fundamentally change the future of personalized medicine and cancer care? It's a pretty exciting question to think about. Thanks for watching.